this is a sad day, another tragic day in America. You have more than 40,000 deaths from coronavirus. And most people know you as COO of Facebook. What they might not know is that you wrote a whole book called Option B with Wharton psychologist and professor Adam Grant about resilience and loss and crisis after you lost your husband, Dave, 5 years ago, tragically and suddenly. And you say that we are all living option B right now.
I think that's right. When my husband died suddenly, I remember asking Adam, how do I know if I can make it through this? It was so unexpected and so tragic. How do I know how much resilience have? And he said, that's the wrong question. Resilience is not a thing we get a little bit of when we're born. Resilience is a muscle, and we build it. We build it in ourselves and we build it in each other. It's about how quickly we recover and rebound from the worst events of life. And right now, everyone's living in option B. People have faced loss. We lost someone in my family. People are facing illness. People are facing anxiety, huge economic hardship. And so a lot of people said, asked us, what can we learn from the resilience work you did? So we released a portion of Option B for free and wrote a new introduction, took the parts of the book that we thought could be most helpful and put them out there to help anyone who wants to look.
You said you lost someone in your family from coronavirus in the last few weeks. Can you share a little bit more?
Yeah, my fiance Tom's first cousin died. And, we're like so many other families where we're mourning the loss of someone that was so important in his whole life, so important to the whole family, and not able to come together and have a funeral. And that's where some of the things I think Option B tries to share are most important. I think one of the things that happens when people face loss is they then face a lot of silence from other people. People call the first week and they say, oh my God, are you okay? But then after that, they don't know what to say. And really showing up for people, remembering to call and reach out, not just day one, but day 2 and day 5 and year 5 is a really important part of this.
Right.
Death becomes kind of an elephant in the room. Once that first week is over, people don't want to acknowledge it. And that often leaves the people closest to the person they lost feeling really alone. And this is a time when so many people are facing that loss. And it's just a good time to remind each other how we show up and we keep showing up for people and kick that elephant right out of the room.
I think you're so right, because I remember much longer ago than your loss, but when I lost my father, I was 15. He was 49 years old, and I remember it was months later that it was hardest, because it's when everyone stops calling and life is supposed to be back to normal. But for you, that's when you're your loneliest or your saddest. So your advice to people now losing so many of their loved ones through coronavirus is keep talking to them, keep calling, keep pestering them. Don't be quiet. Bring it up.
Absolutely. Kick the elephant right out of the room. When I lost Dave, before that I would walk into work and, everyone would talk. I could silence any room by just walking in. And I think one of the things when people are facing hardship is we're afraid to bring it up because we don't want to upset them. You can't remind me Dave died. I know Dave died. Even 5 years later, if you say, I'm sorry for your loss, I'm not like, oh my God, you reminded me. When someone has cancer and you say, how's your treatment going? How are you? You're not reminding her she has cancer. She knows that. And in the face of this, when so many people are suffering, making sure you show them that you are there to talk about it, especially now that we all have to talk long distance, I think is more important than ever.
What did your research on resilience with Adam Grant teach you about what you guys call collective resilience? Because that's what I think we need as not just a nation, but a world, a whole lot of right now. What is collective resilience?
Well, resilience is a muscle. We build it in ourselves and we build it in each other. And that's what collective resilience is. I'll give you a beautiful example from Facebook. There's a woman named Emily. She lives in Texas. She has asthma and a newborn, and her husband is an ER doc treating coronavirus patients. So they were really afraid. What do they do about their living situation? She posted on Facebook asking if there was any stranger out there who would lend them an RV, and someone did. And now her husband is living in an RV in front of her house, so where he can still see her and the baby, but not really bring them any risk of infection. And then they started a Facebook group to connect healthcare workers and owners of RVs. That's collective resilience. That is people helping other people. But also, I think that story shows how communities come together and gives a lot of people a lot of hope that they'll get through this crisis, which in turn builds that resilience muscle for everyone involved and everyone who sees it.
There's also a real sense of guilt, I think, right now for people who are healthy and who are doing okay. I feel a lot of guilt not only for health but for having a job and a good job and being able to support my family and not having these unimaginable uh, positions where you have a job one day and it's completely gone overnight. People in every sector are facing this. And I know you write about this in the book, about just dealing with that guilt and if there's any way to put it forward into better collective action.
Well, I think there is. When psychologists study people who overcome hardships, it's the three P's are the things to remember. And the first is what you're talking about. It's personalization. In the face of hardship for yourself or others, blaming yourself. Of course, people who have jobs, I feel that same guilt you feel, have that guilt. But that doesn't actually help anyone get a job. Self-compassion and helping other people, if we can turn to that, that's just much more useful and takes away that first P of personalization, permanence. When you're facing real loss, when you're feeling sick in the middle of this unbelievable crisis, it feels like it's never going to end. And we actually don't know. We don't know when we're going to stop sheltering at home. Essential workers don't know when just doing their jobs is not going to cause them so much risk. But we do know it won't last forever. So remembering that this is not permanent. And I think the third P is the most important, which is pervasiveness. Understanding that there are still parts of our lives that are good. And this is actually a hard lesson because it's pretty counterintuitive. When I first lost Dave, Adam said to me, you know, it could be real worse. And I said, worse? My husband just literally died like this. I found him in a gym. Worse? And he said, yes, Dave could have had that cardiac arrhythmia driving your children. And in that moment, to this day, when I think we're about to say that, I'm like, oh my God, my kids are alive. I'm fine. In the very worst of moments, finding what's still good by asking ourselves what could be worse. Tom, my fiance, and I, we look at each other. We know he lost his cousin, but there are so many people in our lives that are still healthy. Finding the things we can still be grateful for, recognizing that it's not pervasive, is what we can take out of this. And I do think that there is deep gratitude on the other side. You know, before Dave died, I never really celebrated my own birthday except like on the zeros or fives. I celebrate every birthday for myself and everyone else because I now know they don't happen. Think about the last time you went to a restaurant, Poppy, or the last time you hugged a friend. Do you even remember when those were? Think about the next time
No,
you
yeah.
hug a friend. How grateful you're going to be, how grateful we all are going to be. That's the kind of gratitude that will help us build resilience and get through this.
That's true. That's true. I think about that a lot. And I say to friends, I can't wait till I can hug you again. I will say, though, Sheryl, for you and I, just so privileged to have our jobs, our incomes, our, platforms. And I worry a lot about what this is going to look like long term for a lot of people. And especially women, minority women, you guys have done at the foundation, not at the Facebook site, but a deep dive into the economic impact of this, of coronavirus on women. This is something Melinda Gates brought up to me last week that she's very, very concerned about. You found Black women twice as likely as white men to say they'd either been laid off, furloughed, or had their hours or pay reduced because of COVID-19. What else did you find?
That's right. I mean, look, every one of us who has the ability to help has a deep responsibility to help. My foundation's doing a lot of work to help through this, including looking at the data. And you're exactly right. Women have lost 60% of the people who've lost jobs are women. That pay gap that we know exists is hurting women even more. And Black women are twice as likely in this moment as white men to have had their jobs lost or their pay and hours reduced. In a personal capacity, I've been doing a lot of work donating and raising money for the food bank. This is not just a health crisis, it's an economic crisis. And 22 million children, 22 million rely on reduced and free breakfast and lunch at dinner at schools, and they're not getting those. And then from
Mhm.
the Facebook side, we really are doing everything we can to help small businesses. We announced a $100 million grant, a $100 million grant program for small business, 40 million of which will be spent in the United States. And those grant
Mhm.
applications are opening up this week and next week. Every
Yeah.
single one of us has a deep responsibility to do everything we can to make
I
sure
would
that we're helping as much as we can.
I would point people to, if you look in the description, if you're watching to this conversation, you'll see a link there. It's to the podcast on my Boss Files series. Sheryl and I did about 2 weeks ago. It's all about Facebook. A lot of your questions on that answered in that podcast, and more on the small business grants as well as misinformation. We'll get to that in a minute. Just before we move on to Facebook, could you talk a little bit about what your research has taught you and grieving yourself, the loss of your husband over the last 5 years? Something that you talk about called post-traumatic growth.
Yeah, I love this point. I'm so glad you asked. So, post traumatic stress, PTSD, everyone's heard of it. But that means it's when you suffer because of trauma, and that's a very real thing we all need to help with. But it actually happens to very few people, and veterans particularly often feel, and our research showed clearly, that a lot of people assume they have it, and most people don't. Most people actually get stronger. Post traumatic growth means that you are stronger, that there is something in your life, and this is hard, which is better because of the loss. Now, I would trade everything I learned to have my husband back for myself and my children, but I can't do that. But I am more grateful. I talked about celebrating birthdays. I am grateful every single day for my life in a way that I never was until when Dave died. My relationships are stronger. I was as close as I thought I could be to my closest friends and my family. But through Dave's death, we all got so much closer. And so as we look at this crisis, can we get closer to our friends and family? Can we appreciate our health? I mean, Poppy, along with, waking up and realizing how grateful I am to have a job, how grateful you are, I'm grateful every day I don't have a cough right now. Every day.
Yeah.
I wake up, I
Yep.
think about it, I don't have a cough. Think about that kind of gratitude and what it does for our lives. I'm reaching out to my friends and family in a new way. I never used to FaceTime my parents. They live in Florida. I just call them. Now I try to FaceTime them and I see their faces, and that's making a really big difference. And so,
Well,
in the face of the worst things in our lives, we can not just get through them, but we can actually bounce forward and, in some ways, make our lives better. And that is collective resilience.
I'm smiling because my mother has learned Zoom. She doesn't have a smartphone,
Yeah,
so she
exactly.
can't FaceTime or any of this. But now every day I get an email. When can I Zoom with the kids? So she was in our kitchen yesterday with us as we were making cookies. We have about 5 minutes. I know you have a meeting with Mark. We won't hold you past that. But I just want to
Monday
talk about
morning
Facebook
meetings.
and some news. And the news that was made last week, Mark said you guys are not bringing anyone back to the office, or no big collective events until June of 2021. Can you talk
Mhm.
about the decision making Facebook is making here, and if you think this crisis has actually changed the company for good in terms of, will many more people work from home for good after this?
Well, we think we have a responsibility to help slow the spread, and our jobs can be done at home. We know that. We're software engineers and business people, and we can work from home. And so we made an announcement last week that we're not having any in person events, that will be more than 50 people till June of 2021. And we're going to keep our offices closed for longer. We told everyone to expect the offices to be closed until at least the end of May and possibly longer. We are also making sure we're paying everyone, whether you can work, whether you can't, contractor, full time, whether you're sick or not. We are able to
Janitor,
pay full salaries,
anyone
and
who
that's really important
cleans
to us.
every position, clean people who clean our offices, all of that paid.
Everyone, absolutely everyone, whether
Okay.
they can work or not.
If people haven't read it this morning, Mark Zuckerberg wrote an opinion piece in the Washington Post this morning announcing a partnership you guys have had going for about 2 weeks. This is with Carnegie Mellon, and you're tracking essentially potential hotspots where you're seeing people report symptoms of COVID-19. Tell us about the study, and then also can you address the obvious privacy concerns about people's health information being out there?
Yeah, so data is super important. It has to be done very, very carefully, but data is an essential tool in getting us through this pandemic. So partnering with Carnegie Mellon 2 weeks ago, we started surveying people in the United States on a daily basis, asking if you have symptoms. The data doesn't go to us, it goes to Carnegie Mellon, and they're sharing aggregate data, and it's a voluntary survey. But what it's doing is showing a very effective map, county by county, of where these symptoms are happening. And we released that symptom map today, and we're going to release it every day. And what that means is that healthcare workers, governments can plan where these outbreaks are, where they're likely to be, and where we're likely to need hospital beds and ventilators. We're also announcing today that we're releasing the survey globally. And that is really important because there's been a lot of concern that not every country and government is releasing honest, fair statistics on what's going on in their country. And this will give us a much better sense of where outbreaks are happening and the magnitude.
Everywhere, China?
We are not available in China, so not as many Chinese users have access, but we are making the survey available to any global users we have.
Yeah. Okay, a final point, and then we'll let you go. We talked a lot in the podcast that people can listen to about misinformation and what COVID misinformation Facebook is taking down if it is deemed harmful to people. Let me just ask you about all the, there are many people organizing groups to not social distance online on Facebook, right? To break those safety and health guidelines. Does Facebook deem those harmful misinformation? Are you taking those down? How do you address that?
So our policies are that anything that's harmful misinformation does come down, and we've removed hundreds of thousands of pieces of content. So if you post and say social distancing doesn't stop the spread of this disease, that's harmful misinformation, and it comes down. With these rallies, we're working with governors. When these rallies are violating state shelter-in-place orders, we're taking those down as well. And we're going to continue to be very aggressive. We're also pointing people to good health information by authorities, the CDC, local governments. And we announced last week that we've now directed 2 billion people to the right information via our COVID-19 Information Center and pop-ups in newsfeed on Facebook and Instagram. And so this is a responsibility we are taking really seriously, and our teams are working around the clock to keep people seeing the right information on Facebook.